I first of all, I really want to thank American Liver Foundation and Ivory and every doctor that's involved. I was involved with the conference last year just as a participant and I fell in love with what I saw and heard. And so I want to thank you for inviting me today to be able to share a little bit about my story and maybe help someone else because uh, I really think that the American Liver Foundation, the resources and the programs they offer can help so many people and help us so much. And so I encourage you to get involved and take part in all the various seminars and programs that we have. But my story started, and actually last Tuesday or this Tuesday, I celebrated 9 years as a liver transplant recipient. And Dr. Zarin Per, if I got it right, I really absolutely loved hearing his story today because I went through part of that. And 11 years ago, I had my transplant, or 11 years ago, probably, I started having stomach issues. And doctors, it was my GI doctor that really wouldn't give up on me. And in 2011, I had problems, and he said, I'm going to start talking to some other doctors. And he did. And in February of 2012, I was diagnosed with having liver cancer. And it's because my doctor wouldn't give up on finding what was wrong with me, that found that I had liver cancer. And then in my story, I remember the first time I went to my transplant doctor and I said to him, and we heard earlier, look for alternatives or, other options. And so I said to him, Doc, what happens if I don't have a transplant? And he looked at me and said, you'll die. And my wife afterwards said to me, you were only kidding that you weren't thinking about having a transplant. I said, no, I just wanted to know what my options were. And so we ruled out the option that I wouldn't have a transplant. And because of where my cancer was, we've heard about the sectioning. We talked at first with my doctor about being able to section off the bad part, but where my tumor was, that wasn't an option. My only option was full transplant. And I actually asked the question earlier about the hepatic because where my cancer was right where the hepatic comes in. And so my only option was to have a total transplant. And I received my donor's hepatic, and I often wondered, is that normal or not? So today I got my answer, so I appreciate that. But the biggest thing that I encourage everyone to know is that today something may not work, but by midnight tonight it may, and you can't ever give up hope. And I use a quote by Henry Ford. And it was a quote that I think that applies to all of us. And that's when everything else seems to be going against us, remember that an airplane takes off against the wind, not with the wind. So if an airplane can take off with all those people going against the wind through a lot of adversity, we too can get through the adversity in our lives. I have a grandson that has a lot of medical problems. He's had 11 surgeries, he's 11 years old, but after surgery, nothing bothers him. But get a paper cut, you think he lost a finger. And so we all worry. We all worry about things. And there's help out there and there's alternatives out there. And I just encourage you to look for the alternatives. 9 years ago, when I had my transplant, a transplant recipient wasn't offered a high-risk liver. And those livers were livers from hepatitis C or from drug overdoses. Today, my transplant doctor and team, they use those livers because hepatitis C can be cured. And I know that at UC, every person that's received one of those livers are cured of the hepatitis C within 30 days. And so, I mean, medicine is constantly changing. So you can't ever give up hope. You can't ever stop looking for maybe an alternative, because what doesn't work today may very well work tomorrow. This past year, I was sitting on an annual gala meeting that American Liver Foundation had, just listening to two of the doctors that came up with the cure of hepatitis C. Was amazing. Just listening to him saying it's just part of our work. And I know, listening to the doctors that have been involved here, that they're always looking for something better. And so I just encourage everyone to don't give up hope. I mean, I'm at 9 years later, I'm really thankful that I had a transplant, because it taught me a lot. There's things that I know now that I never knew before. I become a big advocate with our transplant group. I was the first patient to really speak to future patients, and I always would tell them that I walked in the shoes, and someday they're going to walk in mine. And I do everything I can to help someone going through what I went through, and I know everyone else here, does the same thing. So that's kind of my story, and I thank all the doctors involved with American Liver Foundation, because today maybe there's not a cure, but tomorrow there may be, and we just can't give up hope that we won't find something to help us. And I know myself, I love giving back and being involved, and so that's my story, and I'll leave it there.
Thanks so much, Don. I think you speak a lot to resilience and hope and curiosity, which really, are three major factors in longevity, right? It's, how do you deal with the cards you've been dealt? How do you find solutions? And I love that perspective, because I think that no matter what situation you're in, you can really hope that you will find an alternative, a solution, somebody to talk to, et cetera. And the fact that you volunteer to speak to other patients is really important, because we as doctors are always looking for people who can, kind of share their story with patients and explain to them that, what they're going through now seems so much in crisis mode, but 9 years after the fact, you're enjoying life and your grandkids and whatnot.
Well, yeah, one of the things I want to add is that, I mean, I went through a lot through my surgery. I'm allergic to tacrolimus. I guess if I took it, I'd know how to pronounce it. But one of the number one anti-rejection medicines they give patients, I was allergic to it. It took, 2 weeks to figure that out. They thought I had a brain aneurysm. I had a lot of bleeding afterwards. That was mentioned earlier. From what I understand, I had over 20 units of blood given to me. I signed cards after I first I would sign cards, Don and others. And to your point, when people would ask me how do I handle it, I used to tell them it's like a poker game. It's not the cards I wanted, but it was the hand I was dealt, and I have to play the hand. And I never gave up hope. There were many nights that I went to bed wondering if I'd wake up tomorrow, but I just never gave up hope.
Yeah.
So.